Good morning, everybody, and welcome back to your Lunch Break Live. My name is Ivana Harinkyu if you're new here, and if you're not, thank you for coming back. Today is Friday, January the 21st, and today we're going to talk about coronavirus rates. Now, I know that we are all sick and tired of talking about this, but we have some pretty astonishing numbers coming in. So our own data reporter, Ramsey Archibald, is here today to explain some of this to us and also use some of the graphs that he's made to kind of get a visual outlook on how these case numbers are going. And we're also going to look at this by county. We know that everybody is always interested to see how their specific county is doing. So I'm going to pull that map up here in just a minute and we'll take a look at that. So Ramsey, thank you for joining us today. And thank you for so before I even get into that, let me tell everybody that we had all these notes. We were about to get going. And then you gave me kind of a fresh set of numbers here. So you've updated your graphs here. We're going to go over the new numbers in a minute. But the story we're going to link has numbers that are a couple hours old that are significantly different. So Ramsey, the story that you had said that there was about 45% positivity rate for Alabama. That's a high number, but it's actually increased this morning. Is that right?
Yep, we're up to 46.3%, exactly 1 percentage point increase over yesterday. And when you're dealing with numbers that are this high, like almost 50% now, 1 percentage point increase is a lot. Like that's a very large increase at this point. So we're seeing, we thought for a while that we may be seeing signs of a slowdown. We might be seeing the start of a peak. And I think at this point, it's safe to say that we're not there yet.
Which is disappointing news for everybody. And again, disappointing news that when we look at a story you published earlier this morning with numbers from yesterday, that there has been such a significant uptick in those numbers from yesterday. So again, Alabama up to 46.3% positivity rate. And what that exactly means is that is the percentage of tests that are coming back positive for COVID in a 7-day period. So Ramsey, I know when I've just talked to friends and family, they will say, oh, does that mean that 46% of people are positive? And it's 46% of people who are being tested. Is that fair?
That's right. And it's important to note that right now, testing is different than it has been throughout much of the pandemic because at-home tests are so much more common. And at-home tests typically don't get reported. And we don't know exactly how that affects this number as far as, do people test negative at home? So that doesn't get entered into the state system. And only people who are really sick go get tested. We don't know that. We just don't know. But what we do know is the rate has never been higher. We're seeing more cases than we've ever seen. So community spread is very rampant right now, and people are definitely getting the coronavirus.
Well, I'm going to go ahead and pull up these maps. Now, again, we're going to start off with one that is just kind of the state overall, and then we'll get into counties. So go ahead and tell me your county if you want to look at your specific county, and then I'll start putting those in line. But first, let's look at the state as a whole. So I'm going to bring this up, and this is Alabama's COVID positivity rate. And this starts out what seems like forever ago at this point, another lifetime, right? In March 2020, you see that spike at the beginning of that graph. Now that's on the left of the screen here. You see how this graph, Ramsey, I know that this has been something you've been working on again for 2 years, and you can see the change that we go to. Until today, until the very end, January, this number is so much higher than what we were in March of 2020.
Oh, yeah. I mean, and you can see, this is sort of like a timeline over the past 2 years now almost. You can see the spike we saw back in January of last year. Now almost December of 2 years ago, almost now. And then the Delta wave back last summer in August and September, you can see that on this map. At that point, that was the steepest spike we'd seen, the highest spike we'd seen as far as positivity rate goes. And we're now looking at almost double that number, and it makes it look small by comparison. So, I mean, it's really telling to look at it over time. Omicron is different than those other strains. Cases and positivity rate are slightly different statistics now just because of the way it spreads and how, it does cause fewer severe illnesses. But if you look at the hospitalization situation, we're still near 3,000 hospitalizations now with more kids than ever in the hospital with COVID. So, I mean, it's still a very serious situation, but just comparing to previous surges is pretty wild.
Well, and I know even that in the updated data we've gotten since you published that stories, now there's about 110 kids who are hospitalized across the state with COVID-19, which is a scary number. Now, already getting requests in to talk about counties, so we're going to do that in 1 second. But Ramsey, I want to quickly ask you about a little tiny dip we can see on this screen. So I'm going to try to zoom in on this. If I can't do it, we're about to find out. But you can see there's a little dip here where it looks like it all this line almost started turning down. And that the date on that is January the 4th, where there was about a 41% positivity rate. You move along that line and you see that 6, 7, 8, 9 we're kind of dipping down a little bit. And then the 10th, 11th is where it really started skyrocketing. So, can we learn anything from this kind of slow dip? I know you mentioned earlier that we're not finished peaking, it seems like at this moment, but there seems to be a few days where things looked a little bit better.
Yeah, and that was part of the reason we thought there may be a little bit of a slowdown, and we thought it could be the sign of a peak or a downturn. But you also have to remember that this data isn't perfect. It could be, remember, it's a 7-day moving average, so it could be that following the January or the New Year's holiday, there was a delay in reporting or something, or people didn't go get tested on the holiday, and then a bunch of people went and got tested later on, which might cause that spike later, or people were out partying and got it and got tested later. There's a lot of reasons that it could happen. I don't know for sure what it was. It could be that people weren't getting as much and now they are for whatever reason. So we really don't know. But for a moment there, it did look like we might be seeing a downturn.
I'm going to look away for just a second here to pull up that county map so we can talk about that one. I know, again, people are always interested, and understandably so, about the region that they live in. So I'm going to pull off this little banner that we have. Well, it kind of fits there. So if you have a county that you want to know the numbers on, let me know. But before people even want to ask about the specific numbers, Ramsey, can you explain the color coding on this map?
Absolutely. So this is just positivity rate. So it's the same number, the percent of tests that come back positive that we were looking at statewide in the previous chart, but now for at the county level. This data is up to date as of, I think, yesterday. That's how ADPH uploads about a day behind for positivity rate data. And the darker the purple, reddish purple color that you see, the higher the positivity rate. And we're now up to 27 counties. So 27 of Alabama's 67 counties are at higher than 50% positivity, which is crazy. That means more than half of people getting tested are coming back positive, which is just a really high number. And we also have 2 counties, that's Cleburne County and DeKalb County, with higher than 60% positivity rate. So, in those counties right now, if you think you have COVID, you probably do.
That's wild, Ramsey, because I remember back in, I don't even remember what year this was at this point. If this was late 2020 or 2021, I can't keep it straight anymore. But there was a conversation of saying that we wouldn't maybe go back into the office until our statewide testing positivity rate was 5% or less. So you look at where we were and we were thinking, oh, we can get to 5%, we can do that. And then now we have 2 counties over 60%. So that just shows the amount of change that's happened here just in that, again, 2 year time period. So
And
people
it's
ask,
worth noting that we were below 5% in early December. We had gotten to that threshold, post Delta. We had gotten there. We were, you want to see that sustained for a while. We finally got down below 5%, and then Omicron comes in and blows all our previous records out of the water.
right. Well, a lot of requests for Jefferson County. You can see here Jefferson County positivity rate is 41.9%. Again, what that means is the percentage of COVID tests that are happening, 41.9% are coming back positive. So it's not necessarily by the population of the county, it's by the amount of testing. So Ramsey, you and I were speaking about that a little bit before we went live here, because I mentioned this county right here, which is Perry County. I'm going to move down to that. You can see Perry County is one of the lighter colors on this map, probably the lightest color, meaning they have what we would call the best rate here. They've got just a 14% positivity rate. So does that have anything to do with the population in Perry County, or does that have to do with the amount of testing that's happening? Tell us a little bit about how to compare these two.
Yeah, I mean, there's a lot of ways to think about it. I mean, in my view, population could affect it, but it could also oftentimes have the opposite effect. Perry County is very small. I think around 10,000 people, or possibly even less, one of the smallest in the state. But if you look around Perry County, their neighbors, just the whole Black Belt region, which is where that is, they're a little bit lower than the rest of the state too. And it's also worth pointing out that, we say low at 14%, back, you know, 4 months ago, 5 months ago, that would have been a high rate. So it's worth putting some context around that number. But there's a lot of reasons why that might be happening. One might be that the Black Belt had slightly higher vaccination rates than some of the other counties in the state, so that you could be seeing fewer people get infected or fewer people get sick and then go get tested. But the good thing about using positivity rate as a comparison is, like you said, the population doesn't really change it. When you're looking at just straight cases, yeah, Jefferson County is going to pop out because they have way more people than any other county. But when you're controlling it for a percentage of tests taken, it sort of helps even out the playing field so that this number is really comparable over, county to county.
Going through some of these requests, we've got Montgomery County. So let me get to Montgomery County here, 43.1%. So a little bit higher than some of the surrounding counties, but again, lower than some of those counties that are over 60%. So that's Montgomery County. Had a request as well for Mobile County. So I'll jump down here, do it slowly. So I might get seasick. Positivity rate in Mobile County, 44.1%. So a little bit above Montgomery County. Now, Ramsey, we saw again a little bit more towards the start of the pandemic that South Alabama, specifically Mobile and Baldwin counties, having a really hard time controlling COVID cases here. It seems like that could still be the case. They are still trending upwards. Again, they are not at that 60% level that we have seen. But what have you seen going on in South Alabama? And have they been kind of a high positivity rate consistently?
Yeah, I mean, you're definitely right about, especially earlier in the pandemic. I mean, when Delta was first hitting, it hit Baldwin and Mobile very hard, very fast. They were some of the first to get truly hit by the Delta surge. And Mobile has been up there this time around with Omicron too. One thing that's kind of interesting actually is that Omicron, and this has been true all over the country and the world, is it hits urban centers quicker, which makes sense. You have higher population density, more people kind of crammed into a small space. So it spreads like wildfire in those areas, and it did already. And what we're now seeing is a more even spread, and it's spreading into rural Alabama. And you see that cluster in northeast Alabama that has some of the highest positivity rates in the state. And there's also a similar cluster on the western side of the state and, in the deep south, which is one reason, again, why I think the Black Belt being less or having a lower positivity rate in general is an interesting thing, because those are some of the most rural counties in the state. So there's something different between those areas that we need to dive into the data a little bit more and find out what's going on.
That's a good point there. Good explanation there, Ramsey. Looking again at some of these requests, we've got several different ones. I'm going to get to it, but you mentioned that northeast corner right there. So I just wanted to zoom in on that. So you can see DeKalb County positivity rate of 60.3. That's one of the two counties that you mentioned, Ramsey, that have an above 60% positivity rate. We also had a request to look at Calhoun. Now, Calhoun County is 45.1% positivity rate, and also Marshall County. So this kind of little corner, we've got a lot of people asking about. And Marshall County here, 47%. So again, that kind of fits with that trend you were mentioning, Ramsey, about that northeast corner that is just, you can tell just by the color coding on this map, they've got a higher positivity rate than especially than the Black Belt and than some of those lower west, so southwest counties.
Yeah, for sure. And this is actually something that's new as of today. Some of these counties really popped over the last, between yesterday and today. And I will say, ADPH has had some issues with case data over the past week or so. So when we're looking at cases, there could be some problems with that. But my understanding is that cases and tests get reported at the same time, so it shouldn't have any effect on this positivity rate metric.
Also getting people asking to look at Madison County. We should note again, Madison County, Huntsville recently surpassed, according to that last census data, as Birmingham as the most populous city in the state. So Madison County is again kind of rivaling Jefferson County with some of those numbers. Madison County's positivity rate, 44.8%. So while they are maybe not as high as some of their neighbors to the east, they still have that high positivity rate there. And you can see that really with this whole North Alabama region. You look especially here at Lawrence County, 59.2. So they are not quite at that 60% level, but they're getting pretty close, along with, again, neighbors right here, we can see 57.4% in Colbert County, Franklin County 55%, and the neighbor to the very north, Lauderdale County, with 54%. So just high positivity happening in that North Alabama region there. So while I'm going through, I'm going to kind of go on the screen, show a couple of these numbers for people that are asking. While I do that, Ramsey, I want to ask you a couple of quick questions. One, I want you to kind of revisit what you said a few minutes ago about seeing if our cases were slowing down and then starting to peak again. We heard a little bit earlier on this month that we could expect cases to peak maybe in the mid to late January, but it doesn't seem like that's happening for Alabama. So just get you to reiterate a little bit of what you said about that earlier while I kind of zoom on some of these counties and get that data out there.
Absolutely. And, at the end of the day, we don't really know why this is happening, why we aren't seeing this peak yet. A lot of other areas with Omicron saw a very large rise, similar to what Alabama saw, then a pretty quick peak and a downturn. And they're starting to see that now if it hasn't already happened. One reason Alabama might not be seeing that is because the state has such a low vaccination rate compared to pretty much everywhere else in the United States. Most other states have a higher rate than we do, and as we know, many people here have been hesitant. So that could be part of it. But as to why we're seeing another uptick, I mean, it would be conjecture to say, exactly what happened. But one thing is for sure, we're seeing an uptick again.
And that's something that nobody enjoys saying, right, Ramsey? One other thing I want to ask you again as I kind of show some of these county numbers is where are you getting this data? We know that there have been people who from the start of the pandemic have questioned the data. And so I just want to give you an opportunity to reiterate where you're getting these numbers from and how we know that they're accurate.
Absolutely. All this data comes from the Alabama Department of Public Health. It's a government agency. They report it. They have case data, testing data, and those two come together to make positivity rate. And they also have hospitalizations data, so I get pretty much everything from there, or there's some federal information that you can get from the CDC or the Department of Health and Human Services, but none of those numbers are used in this particular data set.
Are there any of these counties, when you were putting the updated numbers in this map, Ramsey, are there any of these counties that really surprised you with their rates?
I mean, like I've said before, I think the most surprising thing is the relatively low rates in the Black Belt. Again, I say relative because they're still quite high compared to previous times during the pandemic. But compared to other parts of the state, they're much lower. Like you said, that Perry County number is pretty surprisingly low compared to a lot of the other states, and compared to the state as a whole, which is, like we said, is at 46.3%. But also on the high end, that northeast segment with Cleburne and DeKalb County is pretty surprisingly high. I mean, anything over 50% is surprising to me, and those are both over 60%. I mean, you're getting close to 2/3 of tests coming back positive. That's quite shocking.
What do we know about the death rates, especially over just the start of this year? Again, only January 21st. About a week ago, we heard from Dr. Williamson of the Alabama Hospital Association, who said that more than 100 people had already died in 2022. And that was only about 2 weeks into the month. So what do we know about death rates so far this year and even just through the start of the pandemic?
Yeah, so deaths are a little bit of a harder metric to track because they're slower. They don't come in as quickly. It takes, weeks, if not months, for a death to be labeled as an official COVID-19 death. And that's something we've seen throughout the entirety of the pandemic. But that being said, ADPH now reports 161 deaths since the start of 2022. And that means deaths that have an official date of 2022. That person died in 2022. They've reported far more than 161 so far this year, but some of those were old, as I said. It takes time for those to come in. If you want to know the exact number, since the start of 2022, ADPH has reported 369 deaths. So about a third of those are during 2022 so far. I would expect, we don't know. Omicron is said to be slightly less severe, but people are still in the hospital and people are still dying, obviously. So I'm not sure if we'll get up to where we were during Delta, which was a more severe version of this virus as far as death rate goes. But I wouldn't expect to really see a full picture for another 2 or 3 weeks, if not longer. And that's just an unfortunate truth about how we track this data. And there's nothing you can really do to speed it up. It just is what it is at this point. So we'll keep an eye on that number, and if we start to see an increase, we'll definitely report on it.
Are these counties doing the same methods of reporting their numbers? Do we believe that these positivity rates are accurate because the reporting is kind of standard at this point?
That's a great question. You would think that 2 years into this, we would have a really good system down, but we still have issues where new labs are getting onboarded where they didn't realize they were supposed to report this way, and there are data delays and problems. I think those things are frustrating, especially if you're someone like me who looks at this data every day, which a lot of people I think have been like that during this pandemic. But I think ADPH is doing the best they can with a huge amount of different people reporting their data in. To answer your question, I don't know. I think most of the counties are on the same page as far as reporting goes, but some of these places might have one or two places reporting data, and who knows whether they're doing it the same way. It's difficult to say.
Now, we know that these maps, again, are linked in your story that we've linked here in the comments. And you can see all of these maps there. And again, they are interactive. So when you hover over them, you can see what your county numbers are, what your neighboring county numbers are, or if you're just curious about another county in the state, you can do all of those in these maps that Ramsey has provided in the story. So Ramsey, again, thank you for your reporting. Thank you for these maps. And again, if you just look at this map and you're just looking for a very quick bit of information that you can take without having to really scroll through it, look at the color coding. Ramsey's done that on all of these kind of county maps that he's done so far these past 2 years. And it's really helpful if you don't have the time to spend to go through it. So you can look at this map and kind of get a general idea of where your county stands. So Ramsey, thank you so much. And again, can you tell everybody about these maps and how to access them?
Yeah, sure. They're all on AL.com. These specific ones that we looked at today are in my most recent story, which is on AL.com today. And we'll have updates to these numbers, this weekend and going forward, pretty much until this wave recedes. And we'll keep you posted.
Well, and we are all hoping that soon, Ramsey. I think we can all agree on that fact there. So, Ramsey, thank you so much again, everybody. Thank you for watching. Have a great weekend, and we will see you.